It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this week, reversing paralysis. A Bulgarian man paralyzed from the chest down is able to walk again. A new surgery used cells responsible for his sense of smell to repair the man's spinal cord. Thousands of people each year suffer from spinal cord injuries. For most of them, it means facing a life of immobility. But now a team of European doctors say they have made a major breakthrough in the quest to treat paralysis.
A knife attack in 2010 left firefighter Darek Fitica with a severed spine. For years, he was confined to a wheelchair. But less than a year after undergoing an experimental new surgery, this is Fitica now.
You are making history now. To me, this is more impressive than a man walking on the moon. Cars are running down.
Dr. Jeffrey Raisman of University College London led the team of British and Polish doctors. Their project was the subject of a BBC documentary. Fitica began receiving the pioneering treatment almost 2 years ago at a Polish hospital. The technique involves olfactory ensheathing cells. The cells inside Fitica's nasal cavity, responsible for his sense of smell, were chosen because they regenerate when they're damaged. The cells were then transplanted into his severed spine and bridged with strips of tissue taken from the ankle. 3 months after surgery, Fitica's thigh muscles began growing.
He's saying that I'm moving the foot to his side.
After extensive rehabilitation, he regained feeling in his legs. Just 6 months after his surgery, and with only the aid of leg braces, Fitica began walking.
It's an incredible feeling. When you can't feel almost half your body, you are helpless. But when it starts coming back, it's like you were born again.
I believe this is the moment when paralysis can be reversed.
The medical world is closely watching his progress. Dr. Dalton Dietrich is a scientific director of the Miami Project to Cure Paralysis.
I think this is important because it's using a combination approach for the first time in a person. Cell therapies, extensive rehabilitation, bridging strategies. It's only one patient, and we have to do much more patients to actually figure out if this is going to work in other individuals.
John, this is unbelievable. Has it worked in other patients?
Well, you know, there's been a lot of activity around this space. You said this is just this one person for this technique. But in the past, there was an attempt to use stem cells, and that kind of ran out of money, that trial. But I love the idea of the combination of cells, so putting some cells in there to help things regenerate, but also having the physical therapy, the mechanical device, and then we've seen with other patients, they have electrical stimulators that they thought at first they put at the base of the spine that it would just sort of stimulate some reflex arc, but somehow, amazingly and surprisingly, it actually stimulated regrowth of nerves in the spinal cord so that people could then just think and move their toes. I think we're seeing a lot of progress in this field.
Extraordinary. Also this week, a new study shows the surprising mistakes adults make at home when giving children medicine. Across the country, kids under the age of 6 become victims on average once every 8 minutes. Holly, tell us about this study.
Yeah, Anthony, the researchers in this case looked at a huge amount of data from poison control centers nationwide. And specifically, they looked at calls that came in involving medication errors for kids under the age of 6. Well, it turns out a huge number of calls came in, 63,000 a year, which is the equivalent of 1 every 8 minutes. And one of the scary things is that a huge portion of those calls involved kids under the age of 1, so the very young children.
Okay, so John, what are the mistakes people are making?
Well, there are some obvious ones like giving, a lot of it is liquid medication and you give the wrong dose. You think it's a teaspoon, it's a tablespoon, a milliliter, you get all that confused. Or just making a medication error, giving the wrong medicine. But the most frequent mistake, 27%, was giving the same medicine twice. And you think about it, it's a little kid under 6, maybe under 1, is not able to say, hey, I got that before. So think about it this way. Here's my advice on this one. If you're giving the medicine, you're the nurse for the household. You're the nurse. And in the hospital, does the nurse just give the medicine and just walk away? No, they chart it.
Yeah.
Make a chart. I gave it at this time.
I'm the unwilling nurse.
Initial it. What's the time you gave it? How much you give it? And then the next person, if it's a different person, says, oh, wait a second, it was already given.
Right. Holly, why are children's medications so hard to dose?
You know, well, part of it, John touched on it. The dosing instructions can really vary widely. Some medicines are given in teaspoons or tablespoons, or you're supposed to measure milliliters. I've even had patients call me and say, this medicine calls for drams. What's a dram?
Yeah.
So, you know, researchers in this case, they're saying we should just have one standard measurement. We should use milliliters only. Also, so people don't reach in their kitchen drawer to give a teaspoon or tablespoon. That's very imprecise.
I invested in the syringe, and I feel like it makes it so much easier for dosing my son.
It's great. I have one too.
Yeah. Well, next week, Colorado and Washington State will celebrate Halloween for the first time since marijuana became widely available in stores. Police are warning parents to check their kids' bags for candy laced with pot. Edibles make up 45% of legal sales in Colorado, and it may be a year or more before the state has regulations to label or possibly even dye edibles a different color. Children's Hospital Colorado has seen child overdose cases go from 9 last year to 13 this year. Most of them are unintentional ingestions.
The National Transportation Safety Board is ringing an alarm over drowsy driving. Safety officials believe it's just as big a threat as drunk driving. According to AAA, 83% of Americans believe drowsy drivers pose a threat to their personal safety. The National Transportation Safety Board is trying to get to the root of the problem to prevent more fatalities. John, of course, it's not just you when you put yourself at risk here, you're putting others at risk as well.
Yeah, and it's so obvious, right? If you're really tired, your reflexes are down, there's a higher chance you get into an accident. I think that whole thing, in people's mind, they can't just say, I'm a little tired, we're all tired. You have to flip it into, I'm drunk. Would you go out and drive if you're drunk?
It's so true, you know, and the impairment that drivers experience, if you've been awake for 24 hours, it's equivalent to a blood alcohol level of 0.1, which is higher than legal in most states. So we have to think about it differently.
All right, Dr. Holly Phillips, Dr. John LaPook, thanks so much for being with us this morning.